So nociception might be one thing, but the experience of pain is very much a outcome of processing, prediction, and decision on protection. Hi, my name is Dr. Deepak, and I'm a full-time NHS pain consultant and author of the Amazon bestseller, The Pain-Free Mindset. If you're new to this channel, thank you for listening to my content and don't forget to subscribe. And if you are already a subscriber, welcome back, and I hope you find this video of great value to you. So this is going to be the second message that I was part of the Flippin Pain campaign recently in Tees Valley. We had 6 messages and we were doing a cycle tour as well as a brain bus experience as we cycled through Tees Valley, promoting and raising awareness about pain science and what we can do to help engage, empower, and educate patients and healthcare professionals in the new science of pain. Now, the second message that we were quite keen on talking about was that hurt does not equal harm. Now, in my book, I talk about this difference between nociception and pain. And I think this is what we wanted to get across to the public and to the healthcare professionals, that if you look at an old, flawed biomedical model, what's called a Cartesian model, where we always think that every time someone has pain, it must be coming from a structure. And then if you do an investigation like an MRI or a scan or a blood test, that would show the reason for pain. The research actually categorically refutes that hurt does not equal harm. Just because you're having pain does not mean nociception is there. What does that mean? Well, nociception is a term that I use and that is now being adopted by the International Association for Study of Pain, which is like the premier organization in the world for pain education. And they are very clear in their new definition from 2020, where they say that nociception does not equal pain and it is very different to it. By nociception, I mean there is the release of chemicals at the site of any injury, and that brings about an activation of the nerves in that area. Now, that means those chemicals are sensitizing the nerves where that injury is occurred. Now, that might be a fracture, that might be a surgery, that might be a fall on a football ground, that might be something else, a flare-up of your rheumatoid arthritis, or a pain in your chest because of a heart attack, or pneumonia, or a tummy problem. But those signals that has activated the nervous system has to travel via the nervous system to the brain. The brain then has to make sense of all of that information. It has to integrate it with whatever prior knowledge it has of that event. It has to decide on whether this has happened before, what its previous response was, and it has to predict whether it needs to protect you or not. Now, the brain is a fantastic organ, but the brain, the nervous system, and some other parts of the body are all coming together to make this decision of processing and prediction to decide on protection. If it decides that protection has to happen, that is when the experience of pain comes along. So nociception might be one thing, but the experience of pain is very much a outcome of processing, prediction, and decision on protection. That is very different. And that's what hurt does not equal to harm. Very important to understand that principle, because once we can understand that, it means we don't have to be the subject of looking for repeated investigations or the cause of pain. In fact, there are a lot of studies that I reference in my book where they have done MRI scans of hips, of knees, of the upper back or the neck or the lower back. And they have done these studies, MRI scans on people who don't have any pain, and they have shown that there are a lot of changes on the MRI scan. So for example, a study on MRI scans of the lower back shows that up to 80% of people who are 50 years or more have got disc bulges, have got degeneration or thinning of the discs, but they have no pain. Similarly, there are MRI scans done of the shoulder or of the knee or the hip where they show that there is cartilage tear or there is labral tears, but they have no pain. So when you do get hurt, how can anyone say that the changes on the scan are the reason for your pain? So this message is about hurt not equaling harm. And on day 2, we had cycled from Darlington all the way to a place called Guisborough, and our conversation that evening to the public was based around the 6 messages, and the second message was hurt does not equal harm, nociception does not equal pain, and that's an important message to take away. Thank you for listening to this video, and I hope you found it useful, and I'll see you in the next video for the third message of the Flippin Pain campaign. Hi, I hope you enjoyed that video. If you want to hear and see more, then please click the subscribe button and hit the notifications button so that you'll know when the next video is released.